Today, we discuss viral E hepatitis infection. Please don't forget this virus, which always we forget about hepatitis E virus, especially in those patients with acute hepatitis A virus when there is prolonged cholestasis or severity of acute viral A hepatitis. Viral E hepatitis, it is similar to that of hepatitis A virus. Hepatitis E virus, it is a waterborne hepatitis. An outbreak in New Delhi in India in 1955, and that is the first time we can diagnose the viral E hepatitis and know about the viral E hepatitis. Other outbreaks in China, in Darfur, South Sudan, Chad, and Uganda. It is worldwide distribution. It is in Africa, Asia, Middle East, Central America. 25% of acute viral hepatitis is due to hepatitis E virus, either alone or maybe with acute hepatitis A virus. Hepatitis E virus is a single-stranded RNA virus, non-enveloped. When the viral E hepatitis come in contact with the liver cell, by it go in with this domain. As we see now, this is the liver cell, and this is the domain. When come in contact with liver cell, uncoat and go on and replicate and shedding out release of viral E hepatitis. This is the viral E hepatitis by electron micrograph of stool in some patients, and it has been found that the viral E hepatitis is three genotype. The genotype, the three genotype, 1, 2, 4 genotype. Genotype 1 and 2 usually infect humans. Genotype 3 and 4 infect human and animal. Genotype 3 is less virulent, therefore the infection may come and go, and we not feel that we have acute hepatitis E virus. As we know now, the genotype 3 and 4 infect both human and animals. Therefore, we can be infected from animals. Therefore, it is a big, the shellfish, blood transfusion from deer, therefore from sheep. Therefore, we don't forget the home animals living with us, which is pet. Don't forget the rat. This is the methods of transmission from the animals to the human. Therefore, transmission from human to human is rare or not common. Therefore, the transmission, as we know, from these animals to the man. What genotype? It is genotype 3 and 4, which can transmit it from human to animal. Therefore, from this, we remember an outbreak on cruise ship consumed shellfish. Therefore, they infected by hepatitis E virus genotype. Therefore, these may transmit the infection to human. The in pig, we detected the hepatitis E virus in the meat of eggs. Therefore, the uncooked or the pig meat can transmit the infection. Therefore, humans in contact with pigs can get the infection. Therefore, what is about the cows? It has been found that the milk of cows can transmit the infection to human, and that is in China. In the Congress, one doctor from Germany discussed this and told us that in Germany, the milk, not cow's milk, not transmit the infection. Why the infection in the China from the cow's milk and in Germany not from the cow's milk? That is in China. The farming is mixed between the cows and the pigs, but in Germany it is separated. Therefore, we can say that the cows infected from pigs and the milk transmit the infection to human. It is very important to know that it is transmitted from contaminated food, as you see here, from cats, and this is a water, and this is a contaminated food. Water can transmit the infection to human. Undercooked barbecue also claimed to transmit the hepatitis E virus to human. Therefore, also in barbecue, there is uncooked vegetables, undercooked meats, or this can transmit the infection. The fruits, especially the strawberries, which cannot be washed completely, it is important for transmission of the infection. What is the clinical manifestation of hepatitis E virus? It is a self-limited acute infection. It is come and go, no symptoms. We don't know that we got the acute hepatitis E virus except by mild symptoms. But fulminant hepatitis can develop in pregnant women, incompetent patients, immunocompetent patients, and chronic liver disease. This is important. Therefore, the pregnant women take care, not take the foods which suspected to be contaminated with viral E. hepatitis. Patients with immunocompetent either disease or taking drugs make the immunity, decrease the immunity, take care from these sources of infection. Chronic hepatitis does not develop, not like after acute hepatitis E virus infection, don't like the hepatitis B or C, which cause chronic liver disease and cirrhosis. Therefore, we can say that hepatitis E virus not develop liver cirrhosis, except in the transplant setting and possibly in other setting of immune suppression. The disease is severe as compared with hepatitis A virus. The acute hepatitis E virus infection, the incubation period is 15 days to 60 days, that is to say, from 2 weeks to 1 month, and asymptomatic in some patients, but usually accompanied with jaundice, malaise, anorexia, nausea, vomiting, abdominal pain, and fever. Prolonged cholestasis in up to 60% of patients. Suspected in patients of drug-induced liver disease. Therefore, we suspect this jaundice from drugs, but not. You should search for hepatitis E virus. When there is fulminant hepatic failure, always please suspect acute hepatitis E viral may be the cause. It occurs more frequently during pregnancy. Therefore, any pregnant woman in the third trimester take care from any food the source of hepatitis E virus. It occurs more frequently during pregnancy and because pregnancy especially may increase the viral replication. Therefore, the fulminant hepatic failure occur more during pregnancy, resulting in high mortality rate of 15 to 25%, primarily in women in the third trimester. Please, any pregnant woman, take care of the source of infection. Pregnant women with jaundice, not only due to acute hepatitis E virus, but please exclude any other cause of this jaundice. The perinatal transmission. There is little information regarding the vertical transmission from infected mother to infants, but there is one report evaluated 8 babies born in the mothers infected with acute hepatitis E virus in the third trimester. 6 of them had clinical, serological, virological evidence of viral E virus. 2 of them died within 24 hours of birth, one of whom had massive hepatic necrosis. Therefore, we know everything about the hepatitis E virus, the genotype, the source of infection, the transmission of infection, and the possibilities of clinical manifestation of acute viral E hepatitis. Therefore, we come. What is the diagnosis? How you make a diagnosis? It is very easy and simple. We find the elevated serum bilirubin, elevated alanine aminotransferase ALT, elevated aspartate aminotransferase AST, detection of immunoglobulin M. It is always from 1 to 8 weeks, but it disappears rapidly over 4 to 5 months. Therefore, you can detect it early and not late. But about the IgG, it increases from acute into convalescent phase, remaining high for 1 to 14 years, but always disappear. As we see now, when there is suspicious detection of a PCR in serum or in stool, hepatitis E virus detected in stool 1 week before the onset of illness, and at that time the patient is infectious before the appearance of symptoms of acute hepatitis E virus and persist for 2 weeks. Therefore, early in the acute hepatitis E virus, the patient is infectious. At that time, there is infection, transmission of infection from human to human through the infected unwashed vegetables, unwashed fruits. Therefore, transmission of infection through the food. Patients is infectious during fecal shedding. Resolution of ALT and AST within 1 to 6 weeks after the onset of the disease. As we know now, this is graph denoting this is the incubation period. When the incubation period from 2 weeks to 1 month, therefore there is a rise of ALT and AST, and there is the immunoglobulin G, EM, start to be positive. But immunoglobulin by IgG, it start and going and increasing from 1 to 14 years. The chronic hepatitis E virus, as we say before, it is not like hepatitis B or C, but it like the hepatitis A virus. Don't got the chronic hepatitis E not progress to liver cirrhosis. Only in some cases, in organ transplant recipient or other setting of immunosuppression, the chronicity after acute infection في these cases from 40 to 80%. Chronicity start after 3 months of infection, progressing to cirrhosis within 1 to 2 years. RNA positivity associated with increased ALT. Hepatitis E virus in malnourished and pre-existing liver disease can lead to hepatic decompensation. Therefore, any patients with cirrhosis or chronic liver disease due to hepatitis C or hepatitis B virus take care from the source of infection mentioned before. As we said before, after solid organ transplantation, liver transplantation, kidney transplantation. In cases of immunosuppression, the predisposed to chronic infection and the clearance of chronic infection after reducing or withdrawing immunosuppressive therapy. Hepatitis E virus, not all in one clinical manifestation. But hepatitis E virus, as we said before, it is a self limiting acute infection and may be transient, may feel nothing. But in other cases, it takes the cholestatic hepatitis, bile in caniculi, and gland like transformation of hepatocyte, or classic type, focal necrosis, ballooned and acidophilic degeneration of hepatocyte, or fulminant hepatitis, which is fatal, submassive as well as massive hepatic necrosis is present. I will show you some of these uh, manifestations. The cholestatic type. This is the cholestatic type. This is the classic type. There is no greenish coloration of these jaundice. The classic type of focal necrosis, ballooning of the hepatocyte, acidophil bodies, and acidophil bodies. Therefore, don't forget, this is the fulminant type. You find all the skin yellowish, not only the sclera, but you find a yellowish coloration of the skin. It is a fulminant type. Take care, it is fatal. It is fatal. May cause massive hepatic necrosis, ascites. Therefore, this is a massive hepatic necrosis. Therefore, now we confronted by three things, either asymptomatic, which is not important, the classic type, the cholestatic type, and the fulminant type. Therefore, it is important to know what is the prevention, how we protect ourselves and our patients. Vaccines against hepatitis E virus are in development. Two large placebo-controlled trials found that vaccination was more than 96% effective in preventing the infection in high-risk setting. Little information the efficacy of immunoglobulin prophylaxis from the prevention of viral E. hepatitis. What can do for travelers to endemic areas? Travelers to endemic areas take care of avoiding drinking water of unknown purity. Take care of eating uncooked shellfish, uncooked vegetables, uncooked fruits. That is why to protect yourself from the viral E. hepatitis. What is about the treatment? As we compare with hepatitis A virus, there is no treatment, just nutritional support and rest. What is about the hepatitis E virus? The treatment remains supportive as like hepatitis A virus because it is self-limiting disease and clearance of infection after and spontaneously. But in may develop chronic infection in immunosuppressed patients and the reduction and withdrawing the immunosuppressive drugs will improve the acute infection and not progress the chronic infection. Ribavirin, it is the treatment. Ribavirin monotherapy, 3 months course, is suggested in some patients in transplant recipient. Viral clearance was also observed after 3 months treatment with pegylated interferon. Treatment with ribavirin initiated 600 mg daily due to glomerular filtration rate of 46 per minute, hemoglobin 10, 10.2, RNA negative at week 4 of therapy, treatment stopped at week 12, ALT become normal, the PCR become negative. By ribavirin, it is the best treatment now in some cases which not resolve spontaneously. The co-infection with hepatitis A virus. Patients with hepatitis A virus had a greater frequency of hepatitis E virus infection in 25% of patients. Why? Probably because of similar route of transmission of infection of both hepatitis A virus and E virus by not healthy foods. The severe cases with cholestasis, relapsing, and acute liver failure may be related to co-infection of hepatitis E virus with the acute hepatitis A virus. What is the case? This is a case of strawberries. Spread of hepatitis A has been reported in the United States and Europe following consumption of contaminated lettuce, beverages, frozen strawberries, salad food, and other food items, transmission of hepatitis E and hepatitis A consumption. Therefore, we can conclude hepatitis E virus infection should be considered for any patients with acute hepatitis. It may be responsible for patients with prolonged cholestasis in up to 60%. In prolonged cholestasis, take care, may be due to hepatitis E virus. In patients, you believe that it is a drug-induced liver injury. Therefore, take care, may be the cause of acute hepatitis E virus. In fulminant hepatic failure, no cause, no, please consider the possibility of acute hepatitis E virus. Then, the pregnant woman with jaundice, consider the acute hepatitis E virus when the third trimester, and don't forget, may be due to other causes. Consider co-infection of hepatitis E virus in patients with acute hepatitis A virus in severe cases of acute hepatitis A virus. And I can say thank you.